Now, I am also being joined by Dr. Rajeev Jayadevan, who is the co-chairman of National Indian Medical Association COVID Task Force. Dr. Rajeev, thank you so much for speaking to us. Dr. Rajeev, gruesome incident again brings back those memories of doctors' protest over what happened in Bengal when a doctor was brutally raped and murdered.
Yes, it's been only 3 months since the incident in Kolkata, and what happened to Dr. Balaji today is completely unacceptable and cannot be excused under any pretext. So there is no excuse or justification for such an event. Now, from the doctors' fraternity side, we have always maintained that the healthcare profession in general and doctors in particular are at high risk of injury from patients' bystanders and patients themselves. Injury can occur either as a result of violence, which can be either premeditated, which is planned, or spontaneous. Spontaneous violence sometimes occurs after a conversation, just like what happens on the road when two vehicles have a slight brush up and the two people start arguing, it escalates into violence. Now, we are not clear what happened in Chennai today, but it appears the assailant was carrying a significant weapon, so it's possible that this is premeditated. And if it is premeditated, the outcomes are more severe as what happened in Kolkata. But the vast majority of incidents of violence against doctors are verbal or physical assault, are spontaneous and can happen in crowded settings when there is lack of security personnel, there is lack of crowd control. There is something called triaging, where not everyone, as the Dr. Anton earlier said, you can't have everyone walk into a healthcare premise because there has to be crowd control. Patients need to be triaged, and the doctors and nurses and others must be given a safe place to work so that they can attend critically ill patients. And sometimes when the patient's condition does not improve or deteriorates, that does not mean that the treatment was wrong. And that is something the society needs to understand. And if the treatment was wrong, there are civil and professional forums for such facts to be looked into, and violence is definitely not an answer.
Absolutely, violence is not the answer. Dr. Rajeev, do you think that before a solution is found out from central government side, or a major overhaul is done, states should take immediate actions? I mean, right now we saw how the man was carrying a dagger inside the hospital he entered, and then this tragedy took place. Do you think, immediate action should be taken up by state governments as well?
Unfortunately, healthcare security has been looked at quite lightly by governments across the country, and that is no secret. That is one of the reasons why we saw nationwide agitations after the Kolkata incident. Now, people may think that these incidents are rare, but let me tell you something. A rare incident like this is a sign or a symptom of a larger picture which carries gross deficiencies. In fact, that is Dr. Deepa, myself, Dr. Rashmi and others, authored the largest study in India on doctors' safety at the workplace. It was published just in October. We demonstrated that 11% of doctors feel completely unsafe at work. 24% of doctors felt unsafe. Half the doctors do not even have a duty room at night. And those doctors who get a duty room do not even get a toilet 1/3 of the time. And there are no CCTVs, there are no security personnel worth speaking of. And if they're present, it's typically old, retired, frail individuals who the doctors complain are often the first to take flight when such an incident happens. So hospitals need to be declared as safe zones. Remember, no matter how aggrieved you are, you did not create violence in an airport. And why is that? Because everybody knows that you can't create violence in an airport. You must go and file a complaint. Likewise, healthcare facilities must be declared safe zones, and a central act must come in place unifying healthcare systems across the country. And it is not just the state governments that need to work.
Dr. Rajeev, if you don't mind, can you list down, 5 quick and easy solutions that hospitals can do on their part? It has been a long debate that government should do this or that. Then government says we don't have infrastructure, we don't have resources. Let's, look at a pragmatic approach towards this problem. What should hospitals do right now? Should they install more, detectors, weapon detectors, metal detectors? Should they employ more people for security arrangements?
Yes, in our study, we asked the doctors themselves who are on the front line for what they think are the solutions. So here are the top solutions. One, provide adequate security personnel who matter. They should look and act like professional security personnel. I already mentioned that earlier. The
Right.
second is crowd control. It's quite common to see drunk bystanders enter in crowds into casualty and threaten nurses and doctors verbally and sometimes physically abusing them. That
Absolutely.
cannot be allowed to happen in any healthcare establishment, private or public. The third will be install professionally managed CCTV monitoring system so that they are not only monitored, but there is preventive action taken as soon as there is any sign of trouble. And the fourth will be a central act that protects all healthcare professionals. That's not just doctors, but let me admit this, doctors are seen as the face of the medical profession and are frequently on the front line. And that is the reason why they are the top targets in such acts of violence. So these
Absolutely.
are the top recommendations from the study.
Well, thank you so much, Dr. Rajeev, for joining us and giving those quick solutions for what we can do on our part. Thank you so much, Dr. Rajeev, for joining us.